Howdy guys, Cardio here from Phlebotomist Report. In this video, I want to talk to you about the 7 must-haves for drawing blood. Okay, let's get into it. Number 1 is the requisition form. The requisition form is a lab document that a doctor uses to select which kind of test he or she wants the patient to do. As a phlebotomist, you need that document because on that document will also include the person's personal details like their name, address, date of birth, phone number, and so on. You need it because you want to verify that the person you have sitting in front of you is the right person, because you don't want to be drawing blood from the wrong individual. Normally, the person's personal details is at the top and the test is below. The test the doctor has selected will also inform you on which collection tube that you need. So based on the test, you will go ahead and select which color tube that you need for you to draw blood from the individual. All of this helps with a smooth flow of activities so that the whole blood draw process goes quickly. The second is the tourniquet. Before I go ahead and talk about the tourniquet, the lab form or the requisition form is not an equipment. It is a piece of document, but we need it. It is one of the first things that we use before we can draw blood. Okay, let's talk about the tourniquet. So for me, when I'm drawing blood, I like to survey the person's arm first. I do that because I want to get an idea what kind of veins the person has. So I will look at the AC area, the forearm, and at the back of the hand. By the time I do that, I have a very good idea where I'm going to draw blood. So I always like to survey the arm first. After I've done that, I'll go ahead and tie the tourniquet. Now remember, when you're putting on the tourniquet, you need to tie it anywhere from 3 to 4 inches above the venipuncture site. You don't want to put it too close to the site, as well as you don't want to put it too far away. So you want it to be anywhere from 3 to 4 inches from the venipuncture area. After you have started blood collection, you can release the tourniquet. Remember to not leave the tourniquet on for more than 1 minute. If you do so, it can result in hemoconcentration. Hemoconcentration will affect the blood, which in turn will affect blood test results. So you only want to leave the tourniquet on for about 1 minute. Let's talk about number 3, alcohol. Normally, guys, we use alcohol when drawing blood. There are some instances you may have an individual that may be allergic to alcohol. So in a case like that, you may use iodine, but normally you're going to use 70% alcohol. We use it to clean the venipuncture area. You don't want there to be any bacteria, because if there is any bacteria on the skin surface, when you're inserting that needle, it will come into contact with the bacteria and the bacteria will be introduced into the person's blood. So you want to clean the area first with alcohol. CLSI recommend cleansing the site with friction with a back and forth motion. If you follow WHO, they still say that you can use the circular motion, which is where you start in the center, you work your way downward and outward to cover an area of 2 centimeters. Wherever you're working, whatever is the facility recommendations or procedures, follow that. So whether it's CLSI or WHO, just go ahead and follow what your facility recommends you to do. Let's talk about the needle apparatus. which is number 4. Basically, there are 3 types of needle system used for drawing blood. The evacuated tube system, which is good for good veins, the needle and the syringe system, and the butterfly needle system. Now, earlier I made mention of surveying the person's arm. When you do that, what it does is it gives you an idea the kind of veins that the person have, whether it is big, whether it is medium, whether it is small, whether it is fragile. And so based on that information, you will know what type of needle to use. So that's why it's a good thing to always survey the person's arm first. After you have chosen the type of needle system, remember to pull down on the skin and anchor that vein before you insert the needle. This is very important because if you don't anchor the vein, if you don't pull down on the skin, it will be more difficult for you to insert the needle into the vein, and that is going to cause more pain to the individual, more discomfort. So you want to remember to tug the skin, anchor the vein before you insert the needle. Number 5, after you have drawn blood, after you've removed the tourniquet, remove the needle from the vein, you want to either use cotton or gauze, apply it to the venipuncture site so that you will stop the blood flow and cause the blood to clot. CLSI recommends that you use gauze. They say that if you use a cotton ball, when you're removing it, the cotton fiber can cause the clot to dislodge. However, WHO still say you can use a cotton ball. I mentioned the both of them because they are 2 big health organizations, and I know some people are following CLSI, some people are following WHO. So again, whatever facility you're working at, follow their recommendations, whether that is CLSI, whether that is WHO, follow what your facility tells you to do. When the bleeding has stopped, you can either apply a band-aid to the venipuncture area, or if you want, you can remove the first piece of gauze you put a fresh piece of gauze and then tape it. You do that in order to prevent any further bleeding, as well as to cover the area and to protect it. Number 6, collection tubes. What I want you to remember about collection tubes is the order of draw. It is very important that we follow the order of draw every time we are drawing blood. The order of draw was put in place for specific reasons, to avoid cross-contamination, and so it's very important that you follow it. You don't want to do your own thing. You want to follow the order of draw, because if you do not follow it, cross-contamination can occur, and that in turn can affect blood test results, which will give you erroneous results for your patient, which can cause problems. So you always want to follow the order of draw. And that is, we have the very first one is blood culture. Then we have sodium citrate, which is coagulation test. Blood culture is the yellow tube. Sodium citrate is the blue. Then we have serum tubes. These are normally red speckled, or gold. Then we have the heparin tube, which is the green closure. Then we have EDTA tube, which is either lavender or pink. And then we have sodium fluoride, which is the gray closure. I put here a mnemonic that you can use to help you remember the order of draw. It goes like this: your brother runs good laps greatly. You want to take the first letter of each word. So Y in your, which would be for yellow, B in brother, which would be for blue, R in runs, which will stand for red, G in good, which will stand for green, L in laps, which will represent lavender, and G in greatly, which will represent gray. So your brother runs good laps greatly. You guys can memorize that, and it will help you to remember the order of draw. The last one here is gloves. This is very important because without gloves we cannot draw blood. The purpose of gloves is to help prevent direct contact with pathogens, either from contact with body fluids, by surface contamination, or by needle stick. You want to wear gloves because it will protect you from the patient, as well as wearing gloves protect the patient from you too. So it's very important that we have gloves on when we are drawing blood. If you have stuck around until the 7th must have, thank you for listening to the end. I've come to the end of this video. If you like this kind of content, please give it a thumbs up. Don't forget to subscribe so that when I make the next video, it will be delivered right to you. Until the next video, have a good day.